Hey guys, I got a lot of questions about what setup I use for extractions and things like that, instruments, a lot of questions on those. So this video is basically going to show you just a basic extraction tray. So this is a tray that we have in my office. Basically, it has all well, I would say most of the instruments we need for most extractions. And I'll kind of take you through basically what we have in the tray. So you can see up top here, it looks like a jumbled mess. There's a lot of things on this tray. And believe it or not, we don't use most everything on the tray for every extraction. So I'll kind of show you how we break this down. This obviously is going to be the suction hose, and everything in the tray is obviously sterile. So we take this out, connect it to the hose and to the wall as well. And so that's that one. Obviously, this one will be the patient bib. So just kind of secure that around the patient. Actually, it goes this way, and then the bib goes in front of the patient that way. So that's also in the tray. To keep your needle secure, you have a needle on the end of this syringe here, and this is just like a guard, so it prevents you from sticking yourself, basically. So it's just one of those. Obviously, the good old anesthesia syringe for dentistry. It has the carpules that fit inside here. And you just twist on whatever gauge and length needle that you need for that. This guy here, Workhorse Minnesota retractor. I get a lot of questions on what this is. What kind of retractor do we use for the flaps and things? It's just a basic Minnesota retractor. If you get a good look at it here, you can see it gets a little bit beat up, right? Because you're working next to drills and things like that. So that's basically the Minnesota retractor. Kind of looks like this. There's different variations of this, but this is like the most common one, basically. This guy, I mean, you're starting IVs or getting PRF, you got a tourniquet, keep them nice and clean, also in the tray. Bite blocks. So these guys, so we usually just loop them together. I don't know, it just seems more efficient. You don't lose them. You can switch them out right to left pretty easily that way. This one goes in the mouth. This one just kind of hangs out like that. And when you want to go to the other side, you just put the other one in and then take this one out. And if you need to pull them out really quickly, you can grab the string and pull them out in case you need to, in case of emergency or something like that. So these are just basic bite blocks or mouth props. Everybody knows what this is. Yeah, so obviously that's dental mirrors in the set as well. Rongeurs, we have two sizes generally. We have a smaller one in the tray, and then we have a medium or larger one. This is a medium size, but we do have larger ones that are also in the trays. Good for chipping away bone, root tips, things like that. Pretty handy. Suture scissors, something to cut your suture with. This is just a basic Dean scissors, just like that. Not meant for tissue, really meant for stitches. Just a basic needle driver. You don't want something too small that you can't get it in all the way, essentially, but you don't want something too bulky like a wire twister or something. So just a basic needle driver will do for most cases of extractions. Unless you're doing complex grafting, you might want something a little finer than this. But generally for most extractions, this works just fine. We call these power pads. These are great for grasping tissue. If you look at the tip of them, if you can even get that, it's kind of a fine thing, but basically that's it there. Good to hold your tissue and then run a suture through it. Very handy that way, and to pick up your needle a lot of times from the other side of the stitch. This is just a basic Bard Parker handle. I don't even use these ones. Honestly, I use the round ones, and I'll show you. This is another blade handle, and this is a round one. I hate these flat ones. I just don't feel like they work. So basically you're like this, and it feels like it's when you're trying to turn a corner on a tooth or something really sharply, I don't like the way it feels. I use the round ones, so when you're just basically have the blade at the end of this and you're just turning the corner, it feels like you're holding a pen or a pencil or drawing almost. So I feel like it's more free for me. So I always use the round handle ones. I get most questions on this little guy. This is a Woodson retractor. So I rarely use a periosteal elevator. For my flaps, this is what I use like 95% of the time, unless I'm doing a huge case where you need a lot of reflection, then yeah, periosteal or something more, robust or something. But this is a Woodson elevator, and I use this most of the time to reflect flaps. This is the periosteal elevator. So a lot of people still use this, which is great. It's a workhorse. It is thicker, on the ends, and so less precise, I would say. But yeah, it's also there. Pickups, cotton pliers, whatever you call them. Basic pickups. I mainly use them to put the gauze in, as I'm doing the throat packs. That really helps. Sometimes picking up roots, they actually work just perfectly at the right angle. But you always need one of these in your tray. Very handy. Small suction. When you start doing the procedure, you want to get your big suction changed out to the small one. Missed this little guy. This is a different size mouth prop. So we have the small child and the little adult, basically. And those work for most people. Bone file. So yeah, you have a sharp edge of bone or something you need to smooth down. Basic bone file in your system helps. This basically, you can see that there as well. Definitely handy when you're taking teeth out to have that. I always use a hemostat. I mean, I have it on the tray. A lot of times I'll just clip it and clamp it on the patient's bib, so it's handy. So you can get a root tip out, grab something really quickly. If the tooth falls out or a piece of tooth falls out, you can grab it pretty quickly. It's super handy. Weeder. I get a lot of questions on what the hell this is. People call it a Weeder retractor or sweetheart retractor. Basically keeps the tongue out of the way. You've seen it in a lot of my videos. It generally stays by itself if you get it in the right spot. Sometimes someone does have to hold it. Patient has kind of a wild tongue or something. For most people, it is tolerated. Very few people just can't tolerate anything back there, because of gag reflex, but definitely helpful. Yank hour suction. So much bigger suction. If you need to suction somebody really quickly or you have a lot of bleeding, you can use the yank hour. And just another size suction there. This is the most common one. Then we have a smaller one if we need to get like a fine tip suction. Root tip picks. So you break a root off or a root does fracture and we have different size root tip picks. Kind of get it in there like this and flick the root out ideally, right? But they're angled in such a way that they can get in a lot of spaces. I don't use these a ton. I do use them, but not for most cases, but they're on the trays. These are POTS elevators. You have one for the right, one for the left, basically. You hold it like this, and usually on upper teeth, but if you get back there and you get the curve of this behind the tooth, and you can kind of flick it out a lot of times, especially for the really high impacted teeth. Helpful, POTS elevators. You're not going to see this Forceps anywhere else. This is my favorite Forceps. I actually use it for most teeth, upper, lower, doesn't matter. It has these serrated edges as well. This has been a little bit used, obviously. Nobody makes this anymore. It has these sweet little grippers on the side. Get a good handle. But the angle of it, so it's angled like this, so you can kind of hold it for lower teeth. You get down in there at a pretty good angle, even for a very back molar. You're not hitting the top teeth with this because of the way it's concave here. Flip it over and you can do the same thing for an upper tooth. You're not hitting the bottom teeth with this part because it's going in. So I use it for most upper and lower teeth. I don't ever use a 150 or a 151. I use this one, 962. You can only get it through me and essentially H&H, but H&H company. But yeah, they're the only ones now that we just make this. That's it. But I can't practice without these things. So I actually had 50 made just for my office alone, just so I have them. Cow horn, basic workhorse for lower molars. You have a lower molar like this. Let's just say you're taking a lower molar out, and it's never going to be this. Well, sometimes it is, but it's never going to be this easy. But basically, the cow horn goes on the buccal and the lingual, and it's just not going to sweetly pop out like that. But that's the idea, and it kind of grips generally in the furcation there, and that's how the cow horn Forceps work. Get in there. There you go. This is like a little stub nose thing. The 222, sometimes for an upper molar way in the back, they don't open wide. You got to get something low profile in there. This is a 222 Forceps. You can get it up there and grab it. Same thing for the bottom. They don't open very wide, so you don't hit the top teeth. You just kind of get this back in there. And sometimes you have a tough tooth. You have a lower molar and it's just, you're using your regular instruments and it's just not working. Sometimes just switching Forceps to something else changes a little bit of the way the force is transmitted on the molar, and that's just enough to get that tooth out because you're basically using a little bit different vector to get it out. So yeah, sometimes I do switch Forceps around. If I'm having a tough tooth and one's really not working, I'll switch it to a different one and see if I can get a little bit more movement with that one, then maybe even go back to the other one and just kind of go back and forth. But 222s, don't use them a ton. Some people use them a lot, but they're handy just because of the low profile. This is like, I don't know, what is this, like a 150, 151? Like I said, I don't even use them. I don't even know if I use them. This is a 150. So generally supposed to be for upper teeth. and they make a 151 for lower teeth. I just think they slip too much in my hands. Like I grab a tooth, and the thing just squirts out like a bar of soap. And so yeah, I don't really use them. Some people love them. I like my 962. Basic ash forceps, bird beak, whatever you want to call it, just because it looks like that. Usually for premolars, lower teeth, you can get it in there, but some people use it on upper teeth. So you have a tooth, kind of like this. You just get it on top of the tooth and you grab it like this and you just twist or buccal, lingual, that kind of stuff. Generally, people use them a lot more for premolars that aren't too far back there. Same thing, you grab it, twist, 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 and you get the tooth out like that. An ash forceps. Those are pretty much all the forceps that we have on the tray. I mean, we have special ones that we can ask for, obviously, like if you need a specialized one, but they're not in every tray. Elevators. So generally 2 straights, like a smaller straight, a thinner one, and then the thicker one. I don't use the larger one as very frequently, but it's there. And this is the small straight elevator and then the corresponding larger elevator. One of my favorite instruments ever, I use it pretty much on every tooth, is this spade. H&H makes this one. This is a Bernard spade. And if you would just order a regular spade, there's so many variations of them. The reason I like this one is because the concave end of the spade is facing this way. So it's good for elevating back molars out, particularly. If you're elevating from the mesial of the molar, this is perfectly angled for that. If you just order the Bernard spade, sometimes they flip this part and the concave's on this side. Not as useful. So you just got to make sure when you're ordering it, you're not ordering the reverse instrument. You're ordering this one. But yeah, this is the Bernard spade. I use it to start pretty much every extraction. And then I go to the next larger elevator. This is a 77R elevator, super workhorse elevator, especially for back molars, but you can use it for pretty much most any tooth. Has a nice little bend in it, so you can really get back to the very back teeth without pinching the lips. This is a Cogswell B. You've seen me use it a ton for purchase points. It has that little angle, then it has that little tip on it that's a little sharper, but it's not razor sharp, but it comes to a little bit of a point there. Get it in there and you just kind of work it out, using that direction. The last things on the tray, this one here, this is the curette. You take out a tooth, little granuloma, just use a curette in there, basically, and get everything out. Super helpful. For bone grafting, something to pack it with. This is just a basic packing instrument and just kind of pack things in on either side. So that's basically what we have in just a basic extraction setup for every case. Like I said, we have instruments and drawers that we use for special occasions, and maybe on another video I'll show you all our special instruments that we use. But that's basically it.